Dr. Nandakumar Jairam, CEO, Chairman and Group Medical Director, Columbia Asia Hospitals, India at Bangalore. I have been associated with Columbia Asia Hospitals since its inception in India, which is from 2004. Columbia Asia as a group entered India as they do in economies that are on the rise in Asia and set up hospitals in this country since then. It's been a fantastic journey for Columbia Asia and myself over the years. My association with them started as me being their group medical director, and I was then privileged to be offered a position on the board. I continued on the board until 2017 when the board requested me to take the additional responsibility of being CEO, which I proudly accepted. And this journey, as I said, has been the best part of my life. Yeah, Columbia Asia, as I said, started in 2004 with one flagship hospital of ours, which was in Hebbal in Bangalore, and soon thereafter began a rapid expansion in the country. We now have 11 hospitals running across the length and breadth of India, in the north as far forward as Patiala, in the east in Calcutta, in the west in Pune, and a large conglomerate in Bangalore which has 5 hospitals spread across the east, north, south and west of the city. We are, as a brand, a multi-speciality hospital group which takes care of the healthcare of middle-class India. In our quest to provide healthcare, we believe in value for money, accessible and high-quality healthcare, provided with empathy and care. Firstly, I'd like to say that we are a global healthcare chain ourselves. We have an equal number of hospitals as we do in India, in Malaysia. We also have our presence in Indonesia, in Vietnam, in the Asian geography. A sister concern of Columbia Asia also exists in China and in Africa. Having said that, we differentiate ourselves on several accounts. The aesthetics of our hospital is something that we are proud of. We ensure cleanliness and we ensure that our hospitals have a look, feel, see that are standard and extremely pleasing to the eye and to a patient who is unwell. We have a highest level of appropriate technology to serve our patients, and we ensure that we reach out to the insured group of people to provide healthcare as much as we do to self-pays. We primarily direct ourselves at middle-class India in an ethical fashion, and we strongly advocate evidence-based practices, transparency and accountability, which are so important in providing healthcare to our nation. Healthcare is changing in this last decade very rapidly. And this is because of the introduction of technology into this space. I must say that as a group, we in Columbia Asia Hospitals were the first to come out with an electronic medical records with which we invested in our first hospital and in every hospital since then. We are proud to say that even today we are nearly paperless and therefore invested in technology far ahead of other players in our own country. Technology is here to stay. We have also to say that we have sufficient data today to ensure that we use this data effectively for the welfare and the wellness of people. Please understand that data can help us not only cure diseases, but identify those who require to be taken care of even before they reach the level of sickness. In other words, promoting good health is an opportunity that data provides. Artificial intelligence can also significantly reduce the time that is taken by a doctor to come up with a diagnosis. And this is the real future of medicine, and we are running rapidly into it. Investing in this space is vital for the survival of any healthcare provider. At this point, we have one hospital under construction in Pune, which will open in 2020. And at this point, I would say that we have completed the first phase of our growth and would consolidate for the next few years before we look at further expansions within this country. I must say that there is aggressive growth in the Malaysian segment, which is growing at a faster pace than in India today.